Guys, welcome back to Medical Coding with Blue on Patreon. Today is a very special episode. It was a request for more information about Modifier 58. So I decided to go ahead and make it into a video because what better way to explain it, right? So I am going to be doing these in the future a little bit more. It just takes time to gather up resources. I just happen to have lots of really good resources about this Modifier 58 in my arsenal. And I will leave the links that I'm reading from in the description box below. I implore you guys to check them out, especially the Novitas website. So Novitas is your one-stop shop for all things about health information and coding. So, and they even do have a evaluation and management tool on here too. I'm just saying. So check it out. This is not an ad, but you know, you know the deal. So anyway, what is Modifier 58? Let's just go ahead and begin. Modifier 58 is defined as a staged or related procedure performed during the postoperative period of the first procedure by the same physician. It sounds a little confusing. Yes. But don't worry, I will break it down for you guys. I'm going to give you guys a really good example. Okay, so let's go on what it says here, the appropriate use. So report when a procedure or service during the postoperative period was planned prospectively or at the time of the original procedure, more extensive than the original procedure, for therapy following a diagnostic surgical procedure, when performing a second or related procedure during the postoperative period. Okay, those are the four instances. But let me go ahead and give you guys an example. A patient comes in and they have fractured their ankle. And the doctor says, okay, I'm going to go ahead and I'm going to do a closed treatment. We're going to put you in a cast. This is going to put this patient into a 90-day global period because he did a closed treatment with this casting, right? And of this fracture, this closed treatment of the fracture. Now, even though he did not go to the OR, he was not put under anesthesia, the simple act of doing this procedure is putting them into a 90-day global period. This means that all of the visits that are related to the treatment of this fracture are going to be covered for the next 90 days because of this procedure that he performed. Now, because this is a 90-day global procedure, on this first visit that he is seeing this patient, he's going to get an evaluation and management, and it depends on whether this is a brand new patient or whether this is an established patient. But if this is a brand new patient, he's going to get a new patient E&M, the appropriate level, right? And he's going to get a 57 modifier, which is decision for surgery because he did this surgery on the same day or within 24 hours, okay? So he's going to get that with a 57 modifier. Then he's going to get his closed treatment of the fracture of the ankle code, right? And so in a couple of weeks, he says to return and we will change your cast and we will check and monitor the progress of your healing, right? So in a few weeks, the patient comes back and they take him out of his cast and they put him under the x-ray machine. They x-ray and make sure that he's okay. And then they apply a second cast, right? So this is a subsequent casting. So this subsequent casting is going to have a different code and it's going to have a 58 modifier on it because this is related to the main procedure, which was the closed treatment. So that's how you know if it is related to the main procedure, which that recasting is related to this main procedure, then you know 58 modifier is going to go on that. So it's going to be a 50 that procedure code for the application of the cast, and then it's going to have the 58 modifier on it, and then it's going to have your laterality, left or right. So if I'm saying it's on the left, it's going to be on the left. Okay, so yeah, that's how that goes. Then you're going to have your 99024, which also says this patient is in a global period. This modifier 58 is going to tell the insurance company that this procedure is related to this main procedure that he is in this global period for, right? So he is in this global period because he had a closed treatment of his fracture. So this procedure is related to this main procedure. That's what that 58 modifier says. So hopefully this makes a little bit more sense, okay? There's a few other instances when you will use this. I'm going to show you guys some more as I read along. But let's talk about the inappropriate use of modifier 58. So staged procedures do not apply to claims for assistant at surgery or services of an ambulatory surgical center. So if there's procedures that do, when there's an assistant, it's not with 58, okay? That's not what you're thinking of, okay? Does not apply to procedures with a XXX global period. So there are some procedures that you will see, and you will typically see this like in the encoder when using the electronic encoder. And it'll tell you, like, there's some that have 000, so that's a 0-day global period. They have some that say 010, which is a 10-day global period. And they have the 090, which is a 90-day global period. And then they have the XXX, which has no global period on it at all. That's what that says. So that does not apply to those procedures, right? So if that procedure is being done, it's not a 58. You don't put 58 on that. Unrelated procedures during the postoperative period. So say, for example, the same patient with a fractured ankle, right? He's coming in and he says during his postoperative visit, he says, hey, doc, my carpal tunnel is flaring up. Is there anything you can do? And the doc looks at it and says, okay, we'll go ahead and give you an injection for the carpal tunnel. So the carpal tunnel injection has a 000, so it has a 0-day global period on it. This means that there's an evaluation and a management component already built in to this procedure code for the carpal tunnel injection. So you would not get an evaluation and management code for this injection. If the provider does the injection, the provider will just get the injection for the carpal tunnel. Okay, and then that will not get a 58 modifier on it because that is not related to the ankle fracture. This is something completely separate. And the provider would just get the injection for that, okay? Because again, there's an evaluation and management component already built into this 0-day global procedure injection. So it's another video for another time, but it's just to give you guys an example on how this is an unrelated procedure and how it would not get a modifier 58. Then it says reporting the treatment of a complication from the original surgery that requires it return to the operating room or service not separately payable, but does not require a return to the operating room. So, or a service not separately payable. Okay. So this means that if reporting the treatment of a complication from the original surgery, that is not going to get a modifier 58 on it, okay? That is another modifier that is going to get. So the example that they have here is a patient with diabetes and advanced circulatory problems has a gangrenous toe removed from her left foot on February the 5th, 2019. At the time of surgery, the physician advises of the possibility of amputating the left foot due to her condition. On February 26, which is about 2.5, almost 3 weeks later, 2019, the physician performed an amputation of the left foot. Bill as follows. Procedure code 28820 with the LT modifier. Amputation of the left toe, 90-day global surgery period. The date of surgery was 5 February 2019. Procedure code 28805 with the 58 modifier on it with the LT, which is for the left side. Amputation through the metatarsal with modifier 58. Date of service, 26 February 2019. Documentation must substantiate the use of modifier 58. The act of the provider saying, if this taking the toe doesn't work, we may have to go back in and take more of the foot because when it comes to circulatory problems and having gangrene, as a diabetic patient, sometimes a provider won't know the extent of the bone damage until they're actually in there. And so that's why he said, we're going to try to take the toe first before we take the foot, because the foot is going to be more of a rehabilitation for this patient. The toe can be difficult rehabilitation as well, especially as for a diabetic. But it's more serious when more of the foot is missing, because now you have to have other things to come into play, other prosthetic devices and things like that. So that is the explanation on that. So hopefully that gets a little bit more clear. But let me go ahead and read something from this other website. Now, this other website, it gets a little bit confusing on how it's talking. And I noticed that earlier, but I still like it because it still breaks down a lot. But it just says Modifier 58 staged or related procedure or service by the same physician during the postoperative period. And it talks about having a decision tree. This website does include a decision tree, so that's why I went ahead and put it on here too. And then it says Modifier 58 is used again for the staged or related procedure. Further, according to cms.gov, Modifier 58 indicates the procedure was planned either at the time of the first procedure or prospectively, okay, more extensive than the first procedure. And then for therapy after a diagnostic surgical procedure. There is some ambiguity here, this thing says, but nowhere in the CPT manual does CMS clarify whether the above conditions are separated by or and. It just goes into more of a split hairs type conversation on here. But examples of when to use Modifier 58. A surgeon performs a biopsy on a patient. The results indicate that the sample is cancerous. The surgeon performs a second procedure to remove the cancer. Use Modifier 58 when billing for the second procedure. Why? Because the surgeon knew the biopsy might result in a further, more extensive procedure pending test results. That's how you would know that it's staged or related, right? But not staged or related, but more extensive, okay? And then the second example is a surgeon performs a procedure to debride a sacral ulcer. During the procedure, the surgeon knows she must perform a skin graft for the ulcer site at a later date. The skin graft will be billed with Modifier 58. Why? Because during the original procedure, the physician knew that the graft procedure would take place. It starts to get a little bit more clear when you have more time with it, more experience with it. But here is when not to use Modifier 58. If a different physician performs the second procedure. Keep that in mind, okay? If a procedure is unrelated, again, talking about the carpal tunnel, that's completely unrelated. You would not use Modifier 58 there. If a procedure does not take place in the postoperative period. So once this patient is out of the global period, right, this Modifier 58 does not apply. Okay? If the procedure was not staged/planned at the time of the first procedure. Okay? And then a case of assistant at surgery services. So that was what I was talking about with the other website. So again, this one is really good. I like this. And I think it's very helpful. So I hope this was clear somewhat on what we have here. Let me see. Yes. So I had done a coding tip of the week, and I had talked about, I gave an example for my providers when they would use Modifier 58. So I said, what happens when you have a closed treatment for a fracture? The patient has a fracture of the left distal radius. The provider opts for a closed reduction. What does the coding look like? And I put the fracture code, which was S52.502A, fracture of the lower end of the left radius initial. And then I put, for the closed treatment of the distal radius fracture is 25605 with the LT modifier. And that's a 90-day global period procedure, right? Closed treatment of a distal radius with manipulation, because I put on there that he had manipulation. And then 99204 with the 57 modifier. That was just a guess, you know. But that 57 is decision for surgery. What do the subsequent visits for the next 90 days look like for this scenario? And I put the fracture code with a D, because that's a subsequent visit and it's a subsequent care for the lower end of the radius. And then I put 29075 with a 58 modifier and an LT modifier for the application of a cast elbow to finger for the replacement of the cast. 58, staged or related procedure or service by the same physician or other qualified health care professional during the postoperative period. LT for the left side, and then modifier 58 is only for the recasting. So that's not going to go on like 99024, which is going to tell you that it's in the global period. It's just going to go on the recasting, okay? Or other procedure that's related, okay? And then I have the 99024 for the post-operative follow-up. If there is no cast change, then the only procedure would be the 99024 with the, of course, the diagnoses. And then I told them if they had any questions to let me know. But that was my coding tip of the week for them back in the day. But yes, I'm going to go ahead and leave this in there, and not going to make this too long, so that way it can be in something like a bite-sized informational snack, if you will. So that way you guys can just sort of take it in. But these modifiers will get easier as you start to explore them. If it doesn't make sense to you, or you're going to request a specific modifier, let me know. Shoot me an email and I will get on it as soon as I can. And I will talk to you guys later, because I want to do this video tonight. I want to upload it and post it. I'm sorry to you guys on the East Coast, because I know it's going to be like 10 o'clock when you guys get it. So I'm sorry. But anyway, I will see y'all on the next video. Bye.